Among the most essential responsibilities of any government is the health and well-being of its people. It is why today's hearing in front of the Senate's Health Committee was so important to all of us, and yet most of the time so deeply disturbing. The witnesses, Susan Minares, she is now the former head of the Center for Disease Control and Prevention, and Deborah Ari, the agency's former chief medical officer, who abruptly resigned after Minares was fired by Donald Trump a few weeks ago at the behest of Health and Human Services Secretary Robert F. Kennedy Jr. In fact, it was that firing that was under the microscope at today's hearing. Specifically, an August 25th meeting between RFK Jr. and Dr. Minares, in which Dr. Minares testified that Kennedy asked she commit in advance to essentially rubber stamping every recommendation of the CDC's vaccine advisory panel, quote, regardless of scientific evidence, in addition to firing certain officials responsible for vaccine policy. Here's what Kennedy said about that same meeting 2 weeks ago and how Minares responded today.
I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes.
Regarding trustworthiness, I cannot define that word for Secretary Kennedy. I made commitments to this committee that I would lead with integrity, transparency, purpose, and work with Congress to maximize health outcomes and protect the American people. Secretary Kennedy told me he could not trust me. I had refused to commit to approving vaccine recommendations without evidence, fire career officials without cause, or resign, and I had shared my concerns with this committee. I told the secretary that if he believed he could not trust me, he could fire me.
So there you have it. He said, she said, if you will. But perhaps even more concerning than Kennedy firing her is why he fired her, why that meeting happens in the first place, what exactly Kennedy was asking Minares to do. Here's one example.
We got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
This afternoon, there's brand new reporting in the Washington Post entered into the record during today's hearing. It casts new light on a prior meeting between Kennedy and Dr. Minares on August 19th. From that Post report, quote, all major CDC policy decisions need prior political approval, a top aide to Kennedy told Minares a week before her ouster. In an August 19th email to Minares, which was obtained by the Post and has not been previously reported, Matthew Buckham, chief of staff at DHS, wrote this, quote, I wanted to elevate the absolute need for political review of major policy decisions at CDC, end quote. He added that Kennedy's office and CDC political leadership should, quote, have eyes on the decisions for approval changes before they go into effect, end quote. In the end, today's crucial testimony highlighted concerns all too common these days in America, an emphasis from the government on loyalty over science and expertise, the gutting of crucial federal agencies that keep all of us and our children safe, and a political party in MAGA less concerned with the actual issues at hand than the so-called anti-Trump lawyers representing the whistleblowers who bring it to light. It's where we start today with some of our favorite experts and friends and reporters. New York Times health policy and politics reporter Cheryl Gay Stolberg is here. Also joining us, host of the Fast Politics podcast, Vanity Fair special correspondent, MSNBC political analyst Molly Jong-Fast is here. Cheryl, I said, he said, she said facetiously. It's he said, she said, and the entire scientific community agrees with her. What, at a big picture level, was today about?
You know, I went into today's hearing looking for signs of how Secretary Kennedy leads his agency. I think that the basic facts around Dr. Menares' firing were kind of already out there. She had written an opinion piece in the Wall Street Journal saying what you just reported, that, you know, he wanted her to fire top scientists and that he wanted her to accept without question forthcoming recommendations from his handpicked panel of vaccine advisors, even without seeing the scientific evidence. What really struck me was the description that she offered of a private meeting between her and Kennedy and some of Kennedy's top deputies, where she said he was very, very upset and animated. He accused the CDC of being a corrupt agency, of being, you know, a tool of the pharma industry, of killing children. And I just found that to be kind of just a vivid look into what it feels like to work for Secretary Kennedy. And mind you, this is a woman who the Secretary himself said had impeccable scientific credentials. He promoted her to be CDC director, and, you know, then 29 days later, he ushered her out the door.
It's an extraordinary thing to hear you say, as a journalist so expert in this. He accused the CDC of killing children, especially with all the science pointing that there are kids dying in America of measles, again, an eradicated disease. Let me play some of this testimony you're describing, though, so all of our viewers can hear it for themselves.
He made another set of assertions associated with CDC that were particularly pointed and particularly hurtful and disparaging. He called, in that context, CDC the most corrupt federal agency in the world, emphasized that CD employees were horrible people. He had said that, I'm sorry. He said that CDC employees were killing children and they don't care. He said that CDC employees were bought by the pharmaceutical industry. He said CDC forced people to wear masks and social distance like a dictatorship. And the one I think that hurt me the most was a particularly vivid phrase he said during the COVID outbreak. CDC told hospitals to turn away sick COVID patients until they had blue lips before allowing them to get treatment.
And it is fair to say, in your view, that those statements are not true.
Those statements are not true.
To your broader point, I think, Cheryl, what we as Americans right now, regardless of for whom we cast our vote or if we didn't cast one at all, the man in charge of our children's vaccine schedules, our access to insurance-covered vaccines, and every decision about our health that is in the hands of an advisory board or an approver or an insurance agency. It's a sliver of the 1% who can make all their own healthcare decisions and pay for it. The rest of us are in the hands of some aspect of the federal government. And the person in charge of all of those things describes the people in one of the most vital agencies he leads as, quote, horrible people. He describes it as the, quote, most corrupt agency and says it's an agency that's killing children. I want to show you something else that came up today. It was about 180 rounds being fired into the CDC building and the trauma that brought about. This is Senator Murphy.
180 rounds being fired into the CDC. What a traumatizing event. Do you fear for the safety of the CDC and of medical personnel if these beliefs about the CDC actually recommending things that hurt people continue to become mainstream?
I do worry about that. I myself was subject to threats, and I am very concerned that the further promulgation of misleading information will undermine not just the safety and health of our children, but it will also exacerbate some of these tensions, the willingness to commit harm if someone is affronted by a belief that the people like us that are trying to help them are actually not trying to help them.
And I would just say it was 500 rounds. It was 180 that hit the building.
180 hit the building.
Each bullet was meant for a person. And each of my staff were very traumatized afterwards. I had staff that were covering their kids in the daycare parking lot. There were people that were out at the ride share as bullets were passing over their head. I have many that won't speak about vaccines now and have removed their names off of papers. They don't wish to present publicly anymore because they feel they were personally targeted because of misinformation.
Cheryl, your thoughts?
You know, it's interesting that you played that clip, Nicole, because that's exactly where my mind was going when we talked about his accusations. You know, I've been around a lot of people in public health at the federal, state, and local level, and they are not going into government public health jobs to get rich. Most of them have a really strong social conscience. They have a sense of mission, and I think that it is particularly painful for them, as Dr. Oury said, for the secretary to be accusing them of these things in the aftermath of this grievous tragedy at CDC headquarters, which took the life of a police officer. And one thing that I was really struck by was that Dr. Menares said that the secretary did not call her to express his condolences after that August 8th shooting. And I might note that President Trump, I do not believe, has ever addressed it either. And Menares said that the next time she spoke to him was when he came down and toured the agency on August 11th, 3 days later. So, you know, I think this was a very painful time for these employees. But more than that, there's a huge concern about trust, and who can you trust? What do American parents listen to when, you know, the HHS secretary is firing the CDC director and accusing the agency of being corrupt?